talk about the do's and don'ts when it comes to discussing race relations with your patients. We're all human, right? So even as a healthcare provider, we are experiencing what's going on in the world and the different racial clashes, just like our patients are. But we may be experiencing them in different ways, especially if we're from a different ethnic background than our patients. If the person wants to discuss how they feel, they will. And if they don't want to discuss how they feel, particularly in the setting of their office visit and their doctor visit, they may not. So that is the first opening, I think, is to find out how that person is doing without probing to see how they're doing specifically when it comes to the race relations in the United States. If the person seems to be experiencing more stress, or they're telling you things that seem to be related to their physical impact of stress or depression, I think it is appropriate to ask that person, why do you feel like you're having more stress at these times? Or why do you feel like you're more depressed in these times? Is there anything that I can do to help? Because that person still may not want to tell you exactly what's going on with them, but they may be open to finding out if there is something more that can be done. Meaning potentially seeing a therapist, potentially seeing a psychiatrist, potentially even discussing their health when it comes to some of the other side effects of stress or sleep deprivation that they may be experiencing. What I would not do, the don'ts, when it comes to being a healthcare provider dealing with patients of ethnic backgrounds in the setting of these the current events of this country and the race relations and the clashes, is I would not ask them to help you to understand their plight or their feelings better. This is not about you right now. So I think the biggest don't is to not use your patient who is of an ethnic background for your own understanding, or to try to understand the other side of what may be going on in the Black Lives Matter setting. I think finding out how they're doing and if there's anything that you can do to help is the most important thing that you can do for that person. And if and when they're willing to let you help, then do your best to do so.